In healthcare marketing, patient placement is often reduced to numbers: how many referrals, how fast, and how efficiently. But for Leni Alston, a healthcare marketer based in Las Vegas, Nevada, the work means something different. She works independently and helps families find safe and supportive group home placements for elderly or vulnerable patients. Her clients are often in crisis, overwhelmed, unsure, and carrying the emotional weight of caring for someone who can't care for themselves. Leni steps into that space quietly. She listens first. Then she acts. Starting out wasn't easy. Leni had to earn trust from both sides, families and care providers. Trust, once earned, became the foundation of her work. But the path wasn't perfect. One early placement seemed ideal on paper, but it didn't work out. Instead of stepping back, Leni leaned in. She revised her process. She started vetting group homes more thoroughly and strengthened her communication with care operators. Leni's days begin early and follow a steady rhythm. She starts with quiet time, cooking or reflecting, before jumping into appointments, tours, or family consults. She relies on handwritten notes, simple lists, and calendar reminders to stay organized. Her short-term goals are clear: place patients carefully and responsibly. Long-term, she's building stronger referral networks and improving outcomes through better communication and trust. Leni's approach is shaped by her upbringing in the Philippines. That background shows in how she treats people, with patience, humility, and warmth. But it also shapes her actions outside of work. When local independent living facilities began reaching out for help, Leni didn't hesitate. She started cooking meals and delivering them, often bringing groceries and clothes along too. She continues this work today, not as part of her job, but as part of her life. Helping people in crisis can be emotionally heavy. For Leni, the pressure is real. But she's developed tools to stay grounded. That mindset, steady, reflective, and clear, is a core part of how she works. Leni doesn't think of her work as sales or numbers. For her, it's about doing the right thing. She's turned down placements that weren't the right fit, even when it meant lost business. But that's never been her focus. Now in her mid-50s, Leni is reflecting more on her journey and sharing what she's learned. She recently launched a personal website to document her experiences and offer insights for new professionals entering the field. Her advice for new professionals: keep it simple, stay honest, and never forget the person at the center of every placement. Leni Alston emphasizes listening and trust over speed and efficiency. An early career mistake led to the development of a stronger placement process. She blends practical tools like checklists with personal reflection to stay focused. Her Filipino upbringing informs her values of service and compassion. Community outreach, including meal and supply donations, is central to her daily life.